All right. Can you hear me? Okay, so my name is Bojan. I'm originally from former Yugoslavia. I came to Canada 15 years ago. I lived in Sugar, in the Eastern Townships. I did my high school and CEGEP in French. And I'm one of the pre-meds, so I went directly from CEGEP to medicine here at McGill. And I stayed here for residency in radiology. I wasn't really exactly in your seats because I didn't do undergrad. And however, I remember when I applied to medicine, I didn't really know what I'm going towards. Nobody in my family is a doctor. I never spent time in hospitals. I never did a volunteering job. I like biology. I like anatomy. So I said, it could be fun. So I went there. I had no idea how much work we need to put in, but so that's why this seminar is really great. It's really good to have a chance to listen what we can say, give our input, how the medical life is, how the residency, and later on. Some of you may have experienced that already, some don't, so I think it's a really good idea. That's why I came back to give another year this talk, because if I can help in your decision making, that's great. So also if you have any questions, just raise your hand and interrupt me. I'll speak about radiology. You'll see medicine is really a field of different domains. And see how mine differs from all of you, what you have heard already. So first of all, I'm going to just tell you what radiology is. And you'll be surprised that many people don't know what radiology or what radiologist does as a daily work. Many people will say, "Oh yeah, you're right. You're the one who treats cancers with radiation." I'll say, "No, it's not me. It's radiation therapy, completely different." Then, "Oh yeah, you're the one who does work with nuclear substances." No, that's nuclear medicine. So, as I say, X-rays, when you break your arm or X-ray, chest X-ray, then they'll catch. That's radiology. Then I'll talk just about life as resident, life as a staff, and some advantages and disadvantages of radiology. So these are just a couple of things we see every day, different modalities and studies. Specifically radiology, we do X-rays, ultrasounds, CT scans, magnetic resonance imaging. There's another field which is part of radiology. It's the interventional radiology or angiography, where we basically go intravascular and assess with the dye. It's like this image here. The patency of the vessels, if there's any stenosis or dilatation. Sometimes if there is aneurysms or pseudoaneurysms or focally dilated vessels, we can treat them. Biopsies, imaging guided biopsies, it's all performed by the radiology. As I said, not to be confused with other similar fields. So radiology as a resident, my work is as follows. So basically we also do 5 years. Majority of the residencies are 5 years, except the family medicine, which is 2. We rotate as a radiology resident. First year we do everything except radiology, so we rotate through internal medicine, surgery, orthopedics, emergency, respirology, GI. So basically we have a general medicine experience. And then the last 4 years we do radiology. And basically during those 4 years we rotate every month to the different modalities. So 1 month we do only ultrasound, 1 month we do only chest imaging, so X-rays or CT scans, 1 month we do only angiography, and we rotate through 7 or 8 different fields throughout these 4 years. We also have, every year we have exams, all to be prepared again for this Royal College, which is a very scary thing at the end. We have, as Andrew was saying, during the year we have 4 weeks of vacation, 1 week of conference, 1 week study leave. So basically about 7 weeks that we have kind of free. And if you think about it, it's really much more than the other professions. Like my friends who are not in medicine, they have 3 or 4 weeks per year, which is a little bit too low. So 7 weeks or 4 weeks, it's really a great deal, and that's the only bright side of the business. We have calls too, and being on call in the radiology is a little bit scary. I'll tell you later about what we do on call. So daily work, I wake a little bit later than I do. I wake at whatever, 7:15 to be at work at 8. That's when my day starts. From 8 and then 5, I'm out of hospital. Sometimes before, sometimes it's less, but at 5, officially my work is done. That differs a lot from the fields of medicine. Very few can do that. We are lucky we are able to do that. We also have about 5 calls per month. During the week, we stayed after 5, we stayed in hospital till the next morning. Over the weekend, I go to hospital at 8 and stay in hospital till 8 on the next day. So it's about 31 weeks of work, a couple of weeks of teaching, and that's my week plus calls. So being on call in radiology can be really not so bad. I'm sitting in the computer, if I receive a call, I have to read an X-ray or CT scan, it's not so bad. However, sometimes it can get really, really stressful. And it's different stress. I don't have to wake up, be told, run, and I have to run. I don't do that, which is a different type of stress. My stressful situation is if there's a patient, and that happens more often than not. When I'm on call at the Montreal General Hospital, which is a trauma center, there's a patient with a big motor vehicle accident who comes, his head is smashed, he has a rib fractures, has a chest tube, he's intubated, his pelvis is half open, bone pelvis, has fractures in the legs. If he's stable, if his blood pressure is there, he goes to the CT scan, and he's basically scanned from the head, C-spine, chest, abdomen, pelvis, sometimes extremities. And the situation is that I'm in front of the computer, and the whole trauma team, so the surgeon, resident, neurosurgeon occasionally, urology resident, they're all beside me and waiting for me to tell them what's happening inside the patient. And so I'm looking, so I have to look. CT scan that has C-spine, chest, abdomen, pelvis in about 4 minutes. Usually during the day, that exam, if there are 4 different people, will take about half an hour, 45 minutes to read. I have 3 to 4 minutes to read and say, does this patient has an important bleed in the head that needs to go to OR right away? Does he have a bleed that can wait a little bit? Does he have a fracture of the cervical spine? So the neck has to be stabilized. It's already stabilized, but more brigade if there's a fracture. If this patient has an aortic injury, this patient has a pneumothorax. Does the patient have injury to the diaphragm? Does the patient have injury to the bowel, to the spleen, to the kidneys? I have that in 4 minutes to the surgeon because she decides what to do. What's the next step? Because fractures of the pelvis, then orthopedics has to be involved, other services have to be involved, and it's all based on my decision. That's stressful. Another stress is I'm on call. I receive a pager from an emergency. That is a 25-year-old girl comes with a headache. It's the first time headache. I just don't like it. Let's just do a CT scan quickly and see if there's anything in the head. If not, I'm going to discharge her home. All right, so I do a CT scan. I read. I send her home. I don't see anything. I say it's fine. The emergency says, okay, you probably just have a migraine, and he sends her home. If I miss a small bleed in her head from the, let's say, subarachnoid hemorrhage, which is a small bleed, which may be a small bleed, maybe a large bleed, but if it's small bleed from the aneurysm, she goes home, that aneurysm ruptures, she dies. And she was sent home because I said there's nothing in her head. There's no bleed or it's normal. Although if I miss it, it's my fault. So that's another type of stress that we deal on call, and we really have to be sure of our decisions. If many other decisions are made upon ours. That's my lack of stress. I don't mind that stress. I prefer that stress than my heart running and reanimating the patient. Work environment. So radiology, yeah, it's predominantly individual job. So basically I have my scans to read or my studies to read, I read them. It's my computer, I read I sit and read